Hi, my name is Dr. Nasha Winters, and I'm a cancer thriver. Here it is, just dropping it right on the table. And a lot of people always want to know my story. They want to know, what did you do? Because that's exactly how I'm going to do it. And I want to start before I even tell you this story, that my story is entirely my story, and that your story and your experience with this is yours. But to give you context to help you understand the biography that led to my biology, that led to the moment that my diagnosis hit, and the completely nonlinear process that unfolded for decades to come and continues today, may help give you a little framework to understand that this isn't a light switch on and a light switch off and an easy button. I wish it were. I don't think I knew what health was when I was born. My mom tells me stories of kicking the ashtray off her belly to understand that literally I was stewing in an environment that her doctors of that time in 1971 encouraged her to do so that she could have a smaller baby. That was the medical advice at the time. And then when I was born, I was not given breast milk because in the 1970s, that was not the normal thing to do. And so we went through formula after formula after formula because I was sick on all of them. My body was trying to tell a story and no one would listen. So when we finally settled on soy formula, it probably shouldn't have been a surprise that I started bleeding when I was 9 years old. And in the late 1970s and early 1980s, those were not stories you'd ever hear or run into. In fact, I just ran into a colleague recently who I went to grade school with, who that story, remembering me starting my period in third grade in Mrs. Richardson's class, if she's listening to this, thank you so much for how you showed up for me. But how much that experience also traumatized an entire generation of young girls that would later become women because it wasn't normal and it wasn't common. Unfortunately, today, it's still not normal, but it's increasingly more common. Fast forward to that, within 2 years of that, I was put on birth control pills to manage the unbelievable, unrelenting pain of my periods. I was diagnosed with endometriosis, and I would bleed 3 weeks on and 1 week off. And I would end up with extreme, extreme anemia and have to get blood transfusions. That's how bad it was. But we just would transfuse and take another pill, just pop an Advil, just pop in a Tylenol to deal with it. I pretty much chomped on those things all the way through junior high and high school. I started putting on massive amounts of makeup to conceal the massive cystic acne that I had as a young woman, the unbelievable emotional scar that led to of the shame and the horror of having to put on this physical thick caked mask to just be able to show up in the world was really, really difficult. And I really feel for people who are dealing with their skin. The way you meet the world is coming through your skin. And so that was this layering cake where they started putting me on antibiotics and then on antifungals as they would give me yeast infections. And I'm giving you all these details so that you understand that even though I'm telling you the horrors of what was going on in my life, by the time I was 14, I had my first course of cryotherapy for my cryoablation for my cervical dysplasia. By 16, it was cervical cancer. They just lasered it off again. That was happening and everyone just normalized it by we're just going to laser that off. We're just going to increase your birth control pills to deal with the pain. We're just going to give you another diagnosis now of IBS because your intermittent constipation diarrhea is a problem. We're just going to put you on another antifungal because of the yeast infection that the antibiotics just gave you. That layer cake, no one ever questioned my health or what was going on. In fact, I would have thought, as everyone else around me would have thought, I was healthy. Every patient I've ever worked with in my career has told me they were healthy until they got cancer. And that story I just told you of who I was the moment I met my cancer diagnosis, nothing about it looking back was healthy. It was normalized. It was medicated. It was suppressed. It was ignored. It was disregarded. And when I did start recognizing that something was inherently wrong, no one would listen. I was ignored. I was shamed. I was, shunned, pushed aside. I was treated like a histrionic teenager drug seeker when I started showing up in the emergency room every few weeks in the summer before my sophomore year of college. It wasn't until my roommate found me unconscious at home that he rushed me to the ER yet again. And I got lucky enough to have a different doctor on call that night who did a more proper workup and to recognize the moment I walked in, he thought I was pregnant. He thought I was about ready to deliver a baby. And that's when they realized, no, that baby I had was accumulation of fluid in the wrong parts of my body, known as ascites, malignant ascites to be specific. And then he noted on pelvic examination that no one else had bothered to do during that time, despite my unrelenting pain that I complained of, that I had a grapefruit-sized tumor in my right ovary. And then they finally ran blood tests, and then they finally ran imaging. And when this poor man came in, when I was conscious enough and they'd had enough fluids in me to come back, my oxygen levels were normalizing. At that moment, they had me on full-on oxygen, and he came in crying because he had a daughter my age to tell me the news of it'll be a few weeks before we have the final details, but we suspect that you have a primary cancer process in your ovary. Wow. Those are those moments that define you. And ironically, for me, leading up to that moment, I normalized everything in my life. I normalized all the illnesses I just shared with you, but I also normalized all the traumas. And I normalized that this was just what I was going to meet in my lifetime and that it wasn't worth living. And in fact, on two different occasions leading up to the years leading up to my diagnosis, I had tried to take my life and was put into intensive therapy and was sure that if I just left my environment, it would fix things. So I literally graduated high school and a week later left my environment and went to an entire new state to start my life over. But what I quickly learned is no matter where you go, there you are. So I just packed it all up and brought it with me. And in that moment when they gave me that diagnosis, I was relieved. Not relieved because they figured out what was going on. I was relieved that this would be a far more, like, kind of a cool way to go. At 19, my 19-year-old brain was like, well, that's a little sexier than trying to shoot your brains out, which I didn't have a gun, so that wouldn't have ever happened, or overdose on pills, which is the means in which I tried to do it before. I thought that just seems to be more noble. But then something else happened, and that when they told me nothing could be done, at that point, they also realized I had a bowel blockage, a complete bowel blockage, which explained why I'd been throwing up for a month and couldn't get anything down, and why my arms were the size of sticks and my legs were the sticks, but my belly looked like a 9.5-month-old, pregnant woman. Recognizing that, and then recognizing that my shortness of breath and all the things is because my blood counts were so low, and that the pain I was having is because I had extensive metastasis in my liver, and I had a tumor the size of a grapefruit pushing against my ureters and shutting down my kidneys. And I had all of these tumors all over the lymph nodes in my system and carpeting my omentum and abdomen throughout my whole body. To realize that all of that pain I'd been experiencing was trying to tell me something for so long and everyone ignored it, I realized in that moment that I'd also spent my life ignoring myself, ignoring my own pain, and swallowing my own pain. And so in that moment when they said, there's nothing can be done, you're so sick, your kidney function is off, your liver is off, we can't do anything. When they told me you have 3 months to live, I said, well, what happens if I take the treatment? And they said, well, you still have 3 months to live. And I said, well, are you going to give me treatment? And they said, no, you're too sick. So I basically said, you're telling me if I do nothing or if I do the treatment, I have 3 months to live. Is that correct? And they said, yes. Now, fast forward, they sent me off for a second opinion, and that second opinion was no different. It would still take a few weeks to get the official diagnosis, which on October 21st, 1991, came that I had a primary ovarian cancer metastasized to my liver and all throughout my abdomen, with suspicions in my lungs and an entire bowel blockage and renal failure because of the real estate being taken up by this giant tumor. That even once it took a few weeks, they had only thing they offered me in those weeks was just draining the fluid in my abdomen, which I had to do several times a week because it would fill up almost as quickly as it would go away. And it would give me a moment of relief, but then it would go away. I still couldn't eat. And not eating was one of the most empowering things I could have ever done because I accidentally stumbled upon the power of fasting, which I did start to employ from that moment forward. And it became very part of my life, as much as a spiritual practice as anything else, but more so out of a necessity. So I tell you all that so you have the context of where I was the moment I found out I was going to die. And the next moment was landing me in a library, picking up a book by a rather unknown person by the name of Deepak Chopra, who wrote a book called Quantum Healing. I sat down on the floor in a sunbeam in the fall day in the library in my little town, mountain town, and I inhaled that book. And I realized I had some choice in this. I had some awareness in this. I had some responsibility of this. I also was very keenly aware that I did not know what I did not know, so I couldn't blame myself. I didn't look at this as my fault, but I knew that I also had the power to change the outcome. And here we are, fast forward 33, it'll be 33 years in October of 2024 that I have been on this dance and on this journey. And all of the things I've done in those 33 years, that's what everybody wants to know of what I did or didn't do. That is honestly the least interesting part of this journey and the least helpful because I stumbled in the dark for the first decade or so. I was strongly actively cancering for at least the first 5 or 6 years. I don't even know how I made it into the new year of 1992 with where I was outside of probably the fact that I was fasting so deeply was instrumental in slowing down the growth. The other part of my fasting was fasting from the origin of a lot of the environment, the soil in which my cancer took root. So for me, what that means very specifically is I was also fasting from my family. And I simply thought leaving the family of origin and moving to another state would be helpful. And I think that it was to change the energetic field, but I was still quite enmeshed in that experience. And so I had a complete disconnect from that for 2 years. I've spent years traveling the world looking for answers, looking for healers, looking for medicines, looking for treatments, looking for the why, looking for the what, looking for the how. And what I've learned is for myself and for everyone I've come in contact with, those are highly individual and highly dynamic. And that whatever you need at any given moment is what you need in that moment based on you and where you are and where your blind spots still are and where you need to still get curious and still turn over that stone and still figure out what your biology and biography dictates to where you are in this moment and how you can address those. There are unlimited amounts of tools: chemotherapy, radiation, off-label drugs, targeted therapies, hormone blockade therapies, IV vitamin C, IV nutrients, intermittent fasting, therapeutic ketosis, therapeutic methionine restriction, methylene blue IVs, all the things, like all the things I'm telling you, people keep looking to those things are going to be what's going to save them. It's not a thing that changes this. There might be tools that help you get more and more clear to who you are and to how to reconnect with yourself in a way that allows you to keep moving forward one moment and one treatment and one discovery at a time.